According to the folks at Family Dentistry, most people in Trinidad and Tobago don't see the dentist chair often enough. Dr. Bernard admits this isn't just a Trinidad and Tobago problem, as around the world most put off dentist visits until they experience significant dental issues.
It's not only Trinidad and Tobago. I think human beings in particular would deal with something if it causes pain. So, you can have a lot of ill health dental wise that doesn't necessarily hurt, and so people wait until it hurts.
But she has noticed a culture of fear in our country.
I think it's cultural for the most part. I have heard people come into the dental clinic and say to the child, "Don't be frightened, look, the dentist there," which makes the child even worse. Or sometimes say to a child, "No more sweets, I'm going to carry it to the dentist and pull out your teeth." That is not the best way to get a child to do what is right concerning dental health. I myself, I didn't go to a dentist before I was 14 years old for the first time. Nothing was hurting, nothing was looking wrong. We didn't know if anything was wrong, and we didn't seem to care too much. We knew we had to brush teeth, and that was about it.
Dr. Beckles stresses that waiting until there is a problem is indeed part of the problem, especially given some of our bad habits. The number one cause of dental health issues: lack of flossing.
People in Trinidad and Tobago do not like to floss their teeth. People brush their teeth, but you're smiling, you too. Yeah. We seem to leave out the flossing, which is what is the best mechanism still for cleaning between the teeth, which is where food sticks, and we have all sorts of foods. And that's where we see the majority of dental decay, cavities, is between the teeth.
But flossing, or lack thereof, is commonly recognized as an international failing. There is another aspect of our culture that causes many to head to the dentist for broken teeth, savoring that flavor right down to the bone, a bit too vigorously.
Biting bones. Trinidad and Tobago, we maybe our cooking is just too good, and maybe we have too many meat eaters. People won't leave the bones alone. And after every single holiday, we have people coming in with complaints. "My tooth broke." I said, "What were you doing?" And we wait for it as a group. "Yes, you were biting on the bone." And it was tasting so good that they had to bite it hard.
The party culture of Trinidad and Tobago also contributes greatly to dental health problems, especially when coupled with late nights out partying, drinking or smoking, where a toothbrush isn't used before partygoers go to sleep, allowing for bacteria to settle and increase odds of tooth decay and cavities.
Brushing at night, especially after Lyme. When we sleep at night, where our tongues are not as active as they are during the day. So nothing is clearing away anything, and the bacteria that live in our mouths have a heyday at night, and that's when they produce all the acid that causes the decay. What we would see having after holidays, an upsurge of accidents, trauma, breakages. But people who tend to Lyme a lot, unfortunately, in my experience, they tend to consume quite a bit of alcohol. Alcohol is not a friend of dental restorations. Too many of them also smoke a lot, which is an even greater enemy for oral tissues.
Dr. Beckles also advises regular trips to the dentist, as they can pick up on other health issues.
When you do regular visits at the dentist, we can identify a number of systemic ills, problems, health problems, just by doing a proper oral exam. So many of the signs, the early signs in a lot of systemic diseases we can detect. And once we raise the flag and have you visit your physician, your medical doctor, you can take care of it before it becomes a major problem. By the time we are able to detect a particular odor, there's a very distinctive odor that presents in the mouth when you are diabetic. We can say to you, listen, have you checked this? You know, there are various forms of cancer that we can detect from signs in the mouth as well.
So maybe you shouldn't put off your trip to the dentist too much. It may not just save your smile, but also your life. Peter Christopher, C News.